Today, we are diving into the absolutely massive transformation your kidneys and urinary system go through during pregnancy. Seriously, think of it as a complete internal remodel. And, understanding it is one of the keys to having a healthy 9 months. So let's just jump right in with a question I know a lot of people have. Why on earth are urinary tract infections, or UTIs, so incredibly common during pregnancy? It's actually one of the most frequent bacterial infections you can face during this time.
And the answer? Well, it's pretty amazing, actually. It all kicks off with a complete pregnancy-driven redesign of your internal plumbing. Your body is preparing for the baby in ways you would probably never even guess.
First up, let's get into what we're calling the urinary remodel. We're going to look at the incredible changes that are a totally normal, healthy part of the pregnancy journey.
Okay, so think of your urinary system kind of like the plumbing in your house, right? Normally, it's a closed, super efficient system. But during pregnancy, hormones like progesterone cause the pipes, those are your ureters, to just relax and get wider. Even your kidneys themselves actually grow larger. This widening, plus the pressure from your growing uterus, well, it creates the perfect environment for bacteria to travel upstream from the bladder right into the kidneys. Now, let's talk about pure performance. Your kidney's cleaning speed is measured by something called the glomerular filtration rate, or GFR for short. And during pregnancy, this speed can ramp up by a staggering 65%. Your kidneys are in absolute overdrive, working tirelessly to filter waste not just for you, but for your growing baby too. And this has some really important real-world consequences for your lab results. Because your kidneys are filtering so efficiently, the levels of waste products like creatinine and urea in your blood naturally go down. So, and this is a crucial point, a creatinine level that would be totally normal for someone who's not pregnant could actually be a red flag during pregnancy. It's a whole new baseline.
So, with that whole remodel in mind, let's move on to our next section, decoding urinary tract infections. This is where those amazing anatomical changes can sometimes, well, lead to some problems.
A UTI isn't just one thing. It's more like a progression. It can start out as what's called asymptomatic bacteria. That just means bacteria in the urine. It's a totally silent infection, no symptoms at all. But if it's left untreated, it can turn into cystitis, which is that classic bladder infection with all the telltale pain and urgency. And from there, it can escalate to pyelonephritis, which is a really serious infection of the kidneys themselves. And this right here is exactly why your doctor collects a urine sample at pretty much every visit. They're screening for that silent infection. Catching and treating it early, even when you feel perfectly fine, can stop a painful bladder infection or even a dangerous kidney infection before they ever start. And a kidney infection can be incredibly serious. I mean, this research finding really puts it all in perspective. In one study, pyelonephritis was the #1 cause of septic shock during pregnancy. That's why prevention and just catching it early are so critical. So, what should you be looking out for? Well, a kidney infection often comes on really suddenly. The key signs are an abrupt fever with shaking chills, a deep, aching pain in your lower back or side, and sometimes nausea, vomiting, and just a total loss of appetite. If you experience these symptoms, it is absolutely essential to get medical care right away. And this isn't just a localized problem, The infection affects your entire body. Endotoxins that are released by the bacteria can cause something called hemolysis. That's the destruction of red blood cells. And that leads to anemia in about a third of patients who get pyelonephritis. Now, UTIs aren't the only issue. Let's shift gears and talk about another common concern, kidney stones, also known as nephrolithiasis. So, how do doctors even diagnose a kidney stone during pregnancy? It usually starts with an ultrasound, which can show if the urinary tract is dilated. That's a really clear sign of a blockage. And if they need a closer look, a CT scan can then pinpoint the exact location of the stone that's causing all the trouble. But here's the good news. While they're definitely painful, about 3/4 of kidney stones pass all on their own with some supportive care, like staying really hydrated and managing the pain. Okay, so far we've talked about what happens when these conditions pop up during pregnancy. But what if you're going into a pregnancy with a kidney condition you already have? Let's take a look. One of the most dramatic changes in pregnancy is this massive, like 50% expansion of your blood volume to support the baby. But chronic kidney disease, or CKD, it really impacts that ability. With mild to moderate disease, the body can actually compensate pretty well. But in severe kidney disease, that crucial expansion gets cut in half, increasing by only about 25%. And why does that matter so much? Well, this limited ability to expand blood volume looks a lot like what doctors see in severe preeclampsia and eclampsia, which are some of the most serious hypertensive disorders of pregnancy. It just goes to show that the body is really struggling to make those necessary cardiovascular adaptations.
Wow, we have covered a lot of ground, from plumbing changes to serious infections. So let's bring it all together in our final section, the key takeaways for staying healthy. So here it is, your health toolkit. First, never ever skip a prenatal checkup. That urine screening is your absolute first line of defense. Second, stay hydrated. Water helps your supercharged kidneys do their job and can help prevent stones. Third, listen to your body and report any symptoms right away, especially things like painful urination, fever, or that low back pain. And finally, just remember that the rules totally change in pregnancy. Don't assume you know what's normal. Let your healthcare provider make that call. Understanding these incredible changes is such a huge step in taking control of your health. So let me leave you with this. What's one small change you can make today to support your body on this amazing journey? Thanks for tuning in.